As we look forward to eating out in bigger groups from Monday, vaccination remains key in our further reopening. Health Minister Ong Ye Kung saying yesterday that before Singapore can relax more restrictions, the target is to achieve 50% full coverage by the 4th week of this month. And this can be reached based on the current vaccination rate, with 3.7 million first doses administered as at yesterday. On average, Singapore is now vaccinating 76,000 people a day, and about 131,000 people have brought forward their second vaccinations appointments. While the World Health Organization, though, has urged extreme caution for countries considering lifting COVID-19 restrictions, they warn that high vaccination rates wouldn't stop rising transmission. With that in mind, let's bring in Associate Professor Alex Cook, Vice Dean of Research at NUS's Swee Hock School of Public Health. Good to have you back on the show, Prof. So, at least 50% of the population fully vaccinated by the end of the month, 65% by National Day, and eventually 80% vaccinated. But what's the risk assessment of each milestone? That cases will rise like we've seen in other countries when they relax their restrictions?
I think there's two main aspects that we can be considering when we look at these milestones. The first is the effect on reducing spread. The second is the effect of reducing severe outcomes such as death. Based on the projections of vaccine uptake in different age groups and a different risk in the different age groups, we think that the mortality risk has already fallen by about 80% since the start of the year. The risk of spread, given a contact, has probably reduced by less, by about 30%. Now, as we hit these milestones that the government has indicated, we think that the effect on transmission will be to fall from a 30% reduction to 40%, 50%, and 55% for those three milestones. The risk of death will probably fall further. We can probably cut the overall risk of death by an extra half if we're able to push up vaccination to around about 90% of the oldest age groups. But what is really critical is not just the percentage who are vaccinated, but who is it that gets vaccinated. If the vaccine uptake doesn't improve further in the older age groups, and we're stuck at that current level of mortality, then that means that many deaths will still happen as we move into the endemic state. And these deaths will primarily be amongst older individuals who are not vaccinated. The milestone I think that we probably need to put more emphasis on is the last of the three milestones, because that's when most of the other measures which are currently in place to prevent spread are thought to be relaxed. Since the Delta variant is so transmissible, even if there's a 50% or reduction or more in the risk of transmission given contact through vaccination, that won't be enough to completely prevent spread in the community. That's why when we look at some of the other countries which are further ahead in their vaccine rollout than we are, like Israel or the UK, once they import the Delta variant, they see a substantial wave of cases of COVID.
Right. Well, Prof, how much will vaccination numbers matter under the new normal when key considerations will then be on hospitalized cases?
Well, exactly. If enough of the older individuals are vaccinated, then even if there are cases, more cases than we're used to in the community, the severe infections, ones which are going to be stretching the healthcare system, the number of those should be manageable. So ideally what we want to see in the next month is for as many unvaccinated younger people to come forward for vaccination to reduce community spread that will lead on to infection of the elderly. And secondly, as many of the unvaccinated elderly individuals to come forward for vaccination, because that will directly link to the reduction in the number of people who need to be hospitalized or who will die of COVID over the next 12 months.
Right. Well, a rosy picture, shall we say it, has been painted for the future. An MC, if you're infected with COVID-19, live concerts, going maskless, and overseas travel eventually. But at what vaccination milestone can we expect to achieve these outcomes? And what are some of the other considerations?
So maybe let's answer that with a rhetorical question. Let's say that we get to that final milestone at 80%, and that's the best that we're able to do. The other 20% cannot get vaccinated because they're too young, or they don't want to get vaccinated. So we reach that milestone, 80%, and there's no one left in the queue waiting to get vaccinated. What advantage would there be at that point from holding off on moving to the rosy picture that you depicted? How can we be any better prepared for endemic COVID? The answer is that we couldn't. From an epidemiological perspective, there's not really any benefit to waiting further unless there are people in the queue who want to get vaccinated but have not had a chance to do so yet. So the only caveat I would say to that is that later this year, hopefully, we should have confirmation that vaccination of younger children under the age of 12 is safe. And at that point, we might be able to vaccinate another 10% or so of the population. Pediatric COVID is quite a mild dose. I'm not convinced that waiting to be able to vaccinate under 12s is a good reason to delay reopening. So I think that when we get to that last milestone, if there's still people in the queue waiting to get vaccinated, then yeah, sure, we can hold off a little bit further. But if there's no one waiting to get vaccinated, I see no epidemiological benefit to doing so.
Well, Professor, as always, thank you so much for your insights. I've been speaking with Associate Professor Alex Cook, Vice Dean of Research at the Swee Hock School of Public Health at NUS.